The Australian Government's future vision for strengthening Medicare saw health leaders recommend better use of data and digital technology to create accessible, person-centred healthcare. Their recommendations included digital prevention to drive better health outcomes for everyone. It was a timely proposal given our ageing population and the increasing burden of chronic disease. The team from Sanoa Health in Melbourne have already spent 10 years researching and developing this very solution. Their technology marries AI and evidence-based medical knowledge to deliver a personalised preventive advice platform known as HealthAnd.
I'm very excited by the fact that HealthAnd can completely transform the way we deliver healthcare and how people manage their health. An analogy would be mobile banking, which has really transformed the way we manage our money. In the same way, I really see HealthAnd being the go-to solution for how we manage our health.
As an active practitioner, Dr. Piraveen Pirakalathanan understands the administrative challenge for both individuals and clinicians. He has overseen the development of the Intelligent HealthAnd platform with the support and input of a board of senior medical practitioners.
Here you go, Mum.
Oh,
This is
thanks,
delicious.
love.
Hey, what's that on your hand there?
HealthAnd's cutting-edge features harness the latest advances in AI technology and follow the RACGP preventive health guidelines. Users are empowered to assess and manage their own health risks wherever they are, as well as effortlessly engage in their own long-term health with their GP's support.
So HealthAnd's unique in a couple of ways. It provides personalised health information, which users can access through completing preventative health checks, and these include bone health, heart health, mental health as examples. In addition to that, it allows you to aggregate and collect all your health information in one location, which is currently quite challenging and difficult.
Anything appearing suddenly or
that's
changing?
odd, yes,
Yeah, that's definitely
definitely.
right. Yes, definitely. So we'll click yes for that one.
HealthAnd overcomes the resistance from Australians who rarely broach the subject of prevention with their GPs, primarily due to access and clinical consult time pressures. The platform has been trialled and tested by thousands of individual users and has already demonstrated that people can and do use digital means to participate in their own health.
Okay, so we're finished. Now we just scroll down here. Oh, look, Mum, it says you're high risk of developing skin cancer, so we better go and make that appointment.
Atticus Health, a network of clinics across southeast Melbourne, have been trialling HealthAnd in 2023 with impressive results to date. Dr. Floyd Gomes sees advantages for both GPs and their patients, with the platform helping maximise their time together, improving productivity and reducing time-consuming administration.
To explore a patient's complete history in the consultation time that's available, you usually end up running late. So the point being, if you want to be a thorough doctor, you do need help along the way. It's a very, very difficult job to be a GP in a short period of time in that 15-minute consult. I can see you filled in the Health and Wellness questionnaire, and it does show you that you're at a high risk of skin cancer. Going digital in our healthcare system is really important because there's a question of productivity, and it's a question of what we can do as a human being compared to what technology can do to complement what it is we're doing. If we look at it that way, this is a really marriage of those two things that makes complete sense.
Early results from the HealthAnd Atticus Health trial have been positive. For example, 12 out of 14 people who used the app to check their skin health were alerted to being at medium or high risk of skin cancer. The HealthAnd platform then directed these patients to take action and seek early intervention with their GP.
Out of those 14 patients, had we not used this platform, it's unlikely we would have ended up with 12 skin checks. That's the reality. But with HealthAnd, we did end up looking at their skin health in that context.
HealthAnd marries expert medical knowledge with potentially life-saving technology, all backed by world-class data security. With this, Sanoa Health are already ahead of the game, with a vision aligned to the recommendations in the Strengthening Medicare Task Force report.
One of the priorities in that report is really about putting the patient at the centre of primary care, and that is one of our key objectives in doing this, being a patient-centred product. The second is modernising primary health, and one of the key ways to do that is using digital technologies, and that is really one of the key objectives that we sing to and that we align to, and our solution really supports doctors in being able to provide better care to their patients.